My name is Heinz Hänel. I'm a professor for zoology from the Goethe University in Frankfurt, Germany. But I spent 40 years of my life in the pharmaceutical industry. And in this period, I mainly worked on development of compounds in anti-infectives, antifungals, also diabetes, and also in neurology. When you talk about neurological diseases, you should separate it into, let's say, 4 big pillars. You have the MS, you have Parkinson, you have Alzheimer, you have a few smaller ones. And these diseases are usually not easily diagnosed. When I met Howard and FBB Bio, this small company, I was introduced to his invention, and I was immediately thrilled and amazed by the, on the one hand side, complexity, and on the other side, simplicity of the model. Let me give you this explanation in a way that I describe it in my words as a biologist. Howard discovered very short pieces of RNA which are somewhere hidden in our cells, and apparently, as former scientists call it, junk RNA. These pieces of RNA are sitting there. In the case of neurologic diseases, they are amplified. That means you can detect them, and the physician could, with a simple blood draw, identify a patient with an early MS or Parkinson or Alzheimer on the spot by just taking this blood sample. So this is why we call it a liquid biopsy. And then the physician gets a report and can tell, okay, this patient can be treated hard and early according to the new guidelines. If you think of those 2 diseases like MS and Parkinson, I would call it a revolution, because the current way to diagnose an early stage of disease is very clumsy. But with this blood draw, it's like that, you take the blood and you have the result. So now we have the proof that the motifs are really linked to those neurological diseases. But here I can smell that in clinical trials for those diseases, there will be a revolution when we use this test. Because up to now, the analysis of the progress or the success of a trial is clumsy and difficult and painful and takes a long time, many questionnaires. Now with this test, simple blood draw, and immediately the physician can see the next day, are the reads going down, or is it staying flat, or even worse? And that means within a few hours he can judge if the therapy is working or not. That shortens the trial, less cost, and early availability of the new drug to the new patient. Now that triggers my idea of using this information as a new tool to develop new medicine for MS by just asking ourselves what the body is indicating. What does the body want with these motifs? Why are they so elevated? How can we stop that? How can we modify this elevation and maybe treating the disease in a completely different way by just bringing the motifs down and thus having not this reaction what we see today. One life, one test. When you translate it into the real life, it's a totally new way of approaching medicine.